Welcome to ECG series where we have step-wise approach to learn ECG in a simple manner. We divided the topic into 8 sections and here we discuss about the part 1, which is the basics you need to know about ECG. ECG is the electrocardiogram where electro means electricity, cardio, heart and gram is graph. ECG is a device that records the electrical activity of heart. A standard ECG has 12 leads. 6 percordial or chest leads. V1 to V6. And 6 limb leads. Lead 1, 2, 3 augmented vector, right, left and foot. Placement of ECG. Lead V1 is placed on right sternal border, 4th intercostal space. V2 on left sternal border, 4th intercostal space. V3 between V2 and V4. V4 on midclavicular line, 5th intercostal space. V5 on anterior axillary line. And finally, V6 mid-axillary line. About the ECG paper. It consists of 5 small squares that makes up one big square. The horizontal line shows the time and vertical shows the voltage. For each small squares, time measures 0.04 second and voltage measures 0.1 millivolt. So one big square is 0.20 seconds and 0.5 millivolt. So, here is an overview of an ECG. P wave, which represents atrial depolarization. QRS complex, represents ventricular depolarization, T wave, ventricular repolarization, and sometimes, U wave, which shows repolarization of Purkinje fibers, it's seen in lead V2. PR interval, from the beginning of P wave till the beginning of QRS complex. The normal PR interval is between 0.1 to 0.22 seconds. QT interval, from the beginning of QRS complex to the end of T wave. It represents the duration of ventricular systole. QT duration for men is less than or equal to 0.45 seconds, for women is less than or equal to 0.47 seconds. J point, to determine ST elevation and depression. Then, ST segment, from the end of QRS complex to the beginning of T wave. For measuring ST segment deviation, PR segment is taken as reference level, which is on the baseline of ECG. If the electric current flows towards the positive electrode on the skin, then it shows a positive wave deflection on ECG. If it flows away from the lead, it's a negative wave. If the wave forms above and below the isoelectric line, it's a biphasic wave. If you like this video, please do like, share and subscribe the channel.